Hi, I'm Marvin Plackett, and today is Monday, May 18th. Greetings to all residents, to all staff, and to all guests. So last Friday, I reported to you that we had a total of 13 COVID confirmations. We now have a total of 17 COVID confirmations. Of those 17, 8 are residents and 9 are staff. Of those 8 residents, 7 of them are at Episcopal Church Home. All lived at Gilbert House, and all of those 7 have been transferred to our dedicated COVID unit on 2nd floor. Gilbert House was on 3rd floor, is on 3rd floor at Episcopal Church Home. All have been transferred to our 2nd floor dedicated COVID unit because on that COVID unit, of course, there is very focused care, and it's easier to isolate that special COVID unit. And then, of course, that helps protect everybody else that isn't tested, or everybody else that doesn't have it elsewhere. The other resident, I said there were 8 residents that have tested positive. That other person, 7 are at Episcopal Church Home, 1 is at Seabury. As I had mentioned, now it's about a week ago or 10 days ago or so that we found that out. And once again, the decisions to transfer residents or not transfer them, though that's done in consultation with our medical director, Minnesota Department of Health, Centers for Disease Control, and Center for Medicare and Medicaid Services, their advice that they send out regularly, and also our internal infection control team. So those are the sources of information that we use to determine whether or not we should be transferring a resident or leaving them in place where they are. At Seabury, of course, it's an apartment. It's easy to isolate right there in that apartment, whereas at Episcopal Church Home, it's more challenging because there are houses with several residents in a house. Well, anywhere from at Episcopal Church Home, I think it's anywhere from 13 up to 21 in a house. And so that's why it's much more important that we carefully figure out this decision of to transfer to our dedicated unit or not, based on this ability to isolate and provide the dedicated care. Many of you received a call fire message from me on Saturday, but some of you didn't because you're not on our list. And if you'd like to get on our call fire list, let me know, and I'll give my email address here at the end. I'm going to read that call fire message to those, or for those of you that did not receive that. And a call fire, that's a automated phone message. I recorded and it's sent out to anybody that's in that call fire list. Hi, this is Marvin. So again, I sent this out. This is what I drafted and what I spoke into that call fire message, and it was sent out on Saturday. Hi, this is Marvin Plackett, and today is Saturday, May 16th. This message is for all residents living on our Episcopal Homes campus and their family members. Last night we received the good news that starting this Monday morning, that's today, May 18th, the Minnesota Department of Health will begin helping us administer mass testing for COVID-19 on our Episcopal Homes campus. This will be very helpful as we fight this virus in order to keep you and our staff as safe as possible. This testing will begin at Episcopal Church Home only. They will test all residents and all staff. There is a good chance that they will also test all residents and staff at the Gardens and Iris Park Commons, but it will not be on Monday, not today, and it has not yet been scheduled. And if they should decide to test any of our independent communities at some point in the future, we will let you know as soon as we find out. We are working very closely with the Minnesota Department of Health, and we welcome their expertise, their resources, and help during this challenging time. We want to let you know that part of their procedure is to implement this major testing effort by using medics from the Minnesota National Guard to assist with administering these tests. Again, we welcome this assistance as it will help us limit the impact of this virus. Our goal is to do as much as possible to keep you and our staff safe. Clearly, these are challenging times for everyone. Fortunately, we have a really good team of staff, and you have been understanding of and cooperative with our restrictions and requirements. Your continuing cooperation is vital, and we are so grateful for it. Thank you. We are with you. We are in this together, and together I am confident that we are going to prevail. So once again, I sent that out on Saturday because we had just found out the evening before, Friday evening, that the health department in combination with the Minnesota National Guard were going to come out this morning, and that's exactly what happened. At 6 o'clock this morning, several, I think it was somewhere around 15 National Guard members showed up, prepared, and started to do their tests, once again, just at Episcopal Church Home. They also then later had 2 teams of National Guards come and join them, 2 additional teams. And so there were a total of 60 National Guard on site at some point during the morning at Episcopal Church Home. Tested all the residents at Episcopal Church Home and all the staff that work at Episcopal Church Home. And while I do not dedicatedly work just at Episcopal Church Home, I of course am in all of our communities. Since I am occasionally at Episcopal Church Home, I too, of course, was subject to that test today. The National Guard, they were extremely professional. They did their job expertly, as we would expect, as we would hope. So we are very, very grateful. We're very grateful to Governor Walz. We're very grateful to Jan Malcolm, the Commissioner of Health, that these resources have been made available. And the National Guard members, they were also very complimentary towards our team at Episcopal Church Home, the leadership under Melissa and our Director of Nursing, Inez, and everybody, very complimentary of how organized we were. They said that we were substantially more organized than other places that they've gone to. So we're so grateful to Melissa, Inez, and their team for being that organized, and they were also very complimentary of how positive the atmosphere was here, how welcoming, etc. So delighted that that's the way we want to conduct ourselves. So delighted that that is the way that we presented ourselves, and it was acknowledged. And once again, we're so grateful for this additional assistance. It helps keep you safe. When I say you, our residents and our staff, it helps keep you safe. The more testing that we do, the better off we are. And then, of course, following all of the requirements that we have been following. Incidentally, the National Guard, they finished their work by right around 12:30 today. So they have now departed an hour ago or so. Some of you maybe are regular watchers of the program on CNN called GPS with Fareed Zakaria. And I happened to catch that program yesterday, and one of his guests they interviewed yesterday was Atul Gawande. And Atul Gawande, some of you have read his book, Being Mortal. Actually, he's written several books. Atul Gawande, he's a professor at Harvard. He is a medical surgeon. He is a person who is an author, of course, written several books. He's also a public health researcher, so quite an accomplished person. And in our field of long-term care, he's really one of the giants. And in that interview, he explained that at the major hospital that he is a surgeon at, that they have done a very good job, not perfect, but a very good job of containing the virus. And as he went down the list of the things that they are doing, every single one of those things is exactly what we are doing here at Episcopal Homes. And that felt very good to get that affirmation from somebody that is such a heavyweight in our field. And the things that he listed are every single staff person, before they start their shift, they go through a screening. Temperature is checked, and then they are asked, do they have any of these symptoms? Do they have any knowledge of having been exposed to COVID-19 through a family member or anyone else? And then if any of these, if there's a red flag to any of those screening items, then of course that staff person is not permitted to start their shift, where they are sent home with pay, but they are sent home. Also, staff, if they have any of those 6 symptoms that are listed for COVID-19, that they are told, do not come into work at all. Don't even show up to get tested. Stay home, let us know that you have a symptom, and then contact your healthcare provider. And then the other basic things of wearing a mask at all times, of social distancing, of frequently washing one's hands. And Atul Gawande, he said you should wash your hands in excess of 10 times a day. Wow, I can assure you I wash my hands 30 to 40 times a day. I have no doubt about it. So frequent hand washing, or frequent washing of hands. So all of those things, as he said, no, any one of these does not get the job done. But you add them all together, you implement them all, and it does a very good job of containing this virus. It's not perfect. As we know, it's not perfect. And of course, sometimes a staff person, sometimes a resident, we make a mistake, right? So it's not perfect. But overall, it does a very good job of containing this virus, as Dr. Atul Gawande explained on Fareed Zakaria's program. Many of you have sent me emails thanking me for this daily update and for other communication that we do with you through, whether it be CallFire or letters, memos, postings on bulletin boards or whatever. So thank you for that feedback. I appreciate that. And just know that I'm going to focus on the facts and not the fears. And I am going to give you timely updates as soon as it is practical to do so. So you can count on that continuing forward. And then I want to remind you that if you have something that you want me to cover, if you have a question that you think should be addressed to the broader audience, let me know, and I will address it here in my daily live update. And once again, this is always Monday through Friday at 1:30 p.m. and then it's posted fairly quickly, within 45 minutes at the longest. It's posted to our website and posted on Facebook. And if you want to contact me, once again, my email address is mplackett@episcopalhomes.org. That's MPLAKUT at episcopalhomes.org. I look forward to seeing you tomorrow at 1:30. Take care and wish you well.